3-4 weeks you will be not able to lift the kit. And after 1 month, I let the patients to lift it slightly from the ground on like small chair. But if you want to carry on the child, it's better to wait around 2 months. And in most cases, because why I tell this, because the muscles of the belly were stitched, so the diastasis is corrected. So if you should try to lift your child too early, what can be the muscles can separate. And also if you have implants in your breast, the movements of the pectoral muscle, it also can cause bad position of the implant, displacement of the implant, and after that, what we can do, only the correction, so the second surgery. And I don't think so we want that. It depends what you are doing after the MMO. So if you are not eating healthy, you don't do exercises, so you can gain weight again, and the result, it can last short. Yeah, maybe you will look better. You will not have like breast ptosis, separation of a muscle, excess of the skin on the belly, but maybe you will not be like slim as you want. So in general, if you are eating healthy, you do exercises, the result can last many years. In some cases, you can look the same as you have, as you did in your young age. Other cases, it can look better. In most cases, if your BMI is a little bit like higher, 28, 27, 29 in some cases, you can look better than before the childbirth. But if you were slim in your young age, so in general you can look the same as you did before. You need to understand that the higher BMI, it causes much more risk of complications, such as infection, separation of a wound, too much bleeding after that. So yes, it's very important. And yeah, in the cases when the BMI is higher than 29, 30, so I tell patients to lose the weight. But sometimes you see the BMI also, it's not that count that you need very to trust, because sometimes like bodybuilder, his or her BMI, it can be very high, but in general it's muscles. And maybe she or he has some loose skin in the belly, excess of the skin. So yes, you can do the surgery because it's the muscles, but it's like very rare cases. And yeah, in like 99%, the BMI is very important, and it must be lower than 28, 27. You shouldn't expect from Mommy Makeover that this surgery it will give you stronger muscles of the belly. We like correct only diastasis of the muscles, so it don't mean that the muscle becomes stronger. Just you don't have the gap between the muscles, but that you definitely will have flat belly after that, it's also not the case, because for the patients also I say that you must make your muscles stronger, so after 2 months I recommend to do exercises. Yeah, in most cases you have flat belly. I don't say that tummy tuck it will not give you flat belly, but you need to understand that if you want definitely flat belly after that, the exercises after that, it's very important.